Hello everybody, Professor Nazmi here to help you work through some of the differences between the flu, the seasonal flu, and COVID-19. There has been a lot of talk about how the flu is very similar to COVID-19, so we shouldn't really worry about COVID-19. On the other hand, there is a lot of misinformation about COVID-19 being perhaps a lot more dangerous and deadly than it actually is. So let's look at some of the differences. The seasonal flu in the United States infects between 4 and 6% of the population every year, with an R0 of about 1.1 to 1.3. The R0 value represents the number of people that are infected by those who have the flu. So if I have the flu, I'm liable to give it to 1.1 to 1.3 other people. That is its virulence or transmission. The total of flu cases per year equals about 14 million to 20 million per year in the United States. Obviously, that is a very wide range, and it varies from year to year. Let's compare that to COVID-19. COVID-19 is more contagious with all the data that we have thus far suggesting it has an R0 of 1.5 to 3.5. In other words, if I have COVID-19, I'm liable to give it to 1.5 to 3.5 other people. The caveat for the COVID-19 column on the right side is that all of this data comes from mainland China, which has a lot of ecological, environmental, social, cultural, economic, and other differences compared to the United States. That is a big caveat with this data. However, if that R0 of 1.5 to 3.5 holds, the total number of cases in the United States would number roughly 16 million to 80 million. Obviously, that is a very broad range, and that estimate is based on the entirety of the COVID-19 outbreak, so not exactly comparable to the flu data. The seasonal flu results in less than 2% of cases, or less than 2% of patients who have the flu being hospitalized. Now let's compare that to hospitalizations from COVID-19, which are in the range of 5 to 15% from the data that we have, which would result in approximately 800,000 to 12 million hospitalizations over the course of the outbreak. Again, a very wide range, but it really depends on a number of factors, which we will see in one moment. The case fatality, or the proportion of people who die with seasonal flu, is less than 0.1% on average. That results in about 15,000 to 60,000 deaths per year in the United States, and that happens all the time. We never hear about it. It's very rarely in the news. The majority of those deaths, 75%, are among the elderly, who have a case fatality of about 10 times the average at about 1%. So 1% of elderly people over the age of 65 who get the seasonal flu every year die. Let's compare that to COVID. The case fatality at the moment, based on the Chinese data we have with all its caveats, ranges from 1 to 3%. 1 to 3% resulting in, depending on the number of cases that we see in the United States, somewhere between 160,000 to 2.5 million deaths. And just like in the flu, elderly case fatality is a lot higher. The range for 65 and over ranges in the 3 to 15 or higher percent range. And again, the caveat being that the data from China is going to be perhaps unrepresentative of what is happening in the US in terms of transmission rates, in terms of care, hospitalizations, pre-existing conditions, comorbidities, and so on. As you know, the flu has a vaccine, which is about 67% effective, which is why everybody should be getting their flu shots, especially those at higher risk. COVID-19 does not have a vaccine. Flu does not have a cure. COVID-19 also does not have a cure. The thing about the flu, though, is that we know a lot about its epidemiology. We know how to predict it. In global terms, it is somewhat predictable in terms of when it's going to happen, when it's going to peak. However, the COVID-19, because it is so new, is of unknown epidemiology. And the fact that we don't know that much about it is the reason everybody is just a little bit scared of it, because we don't know enough from the data that we have to determine exactly what type of transmission, what type of virulence, what types of outcomes or consequences, what types of underlying conditions contribute to what levels of excess risk. So it is all It is all kind of new data, and all of the evidence that we would love to have is being collected. In several months, the data will be a little bit richer, so we'll be able to know a little bit about more how it travels through the United States and the characteristics of the virus, whereas at the moment it is somewhat unknown. However, perhaps the most important point about flu and COVID-19 is that they are both preventable. They are preventable, and so the measures that we are taking with COVID-19, washing your hands, social distancing, sanitizing surfaces, staying away from crowds, self-isolation, quarantine, closing schools, and so on, are going to help diminish the rate of transmission of COVID-19 and also the number of infections of COVID-19. Now, that would also be the case with the flu, but we don't take those types of measures with the flu for a number of reasons. But with novel outbreaks like this that seem to have higher risk, those measures are absolutely effective in keeping people and populations safer. Okay, guys, hopefully that's been helpful. If you have any questions, please feel free to reach out. Take care of yourselves, and I will see you soon.